I'm Dr. Jang from Leon Wills Memorial Hospital in Suwon, Korea. Today, I want to talk about the surgical result of multi-level ALIF with percutaneous fixation in degenerative lumbar scoliosis. Thank you. And this is our disclosure. With Memorial Hospital is special hospital for spine and joint surgery, and our main concern is minimal invasive spine surgery, especially uni or biportal endoscopic surgery. But sometimes such like patients with degenerative scoliosis also visited our hospital. This case is 75 years old female. She complained severe right anterior side pain and mild back pain. So in that case, we only performed the endoscopic decompression on right L23, so patient's symptom was nearly improved. I will show another case. This case is 73 years old female. She complained severe low back pain and NIC and radiculopathy. MRI scan shows multi-level foraminal and central stenosis. And CT scan shows multi-level vacuum phenomenon on disc level. So in the case, what is your option if the patient's symptom was not improved? Various surgical options can be considered: simple decompression, sometimes limited fusion, or some other minimal invasive procedure. Among them, our selection is multi-level ALIF with percutaneous fixation without direct spinal kinetic compression. This is our surgical indications. And between 2013 to 2016, total 28 patients were performed multi-level ALIF with percutaneous fixation in our institute too. And simple radiographs were obtained to coronal angle and lumbar lordosis and some pelvic parameters. And clinical outcome was assessed by BAS and ODI score and so on. In result, mean follow-up period was 32 months and mean age was 68 years old. And as you can in this table, coronal curve angle and lumbar lordosis and some pelvic parameters were well improved after surgery and relatively well maintained at last follow. But some patients were combined with marked stator imbalance. So I checked some change of the lumbar lordosis and pelvic parameters during the follow-up period. And you can see in this table some loss of lumbar lordosis and correction loss of pelvic parameters were observed at last follow-up in group with marked stator imbalance. This figure also shows some loss of lumbar lordosis and PI-LL mismatch in cases with marked imbalance. Clinical outcomes were all improved using the BAS and ODI scores. Mean operation time was 4 hours, and mean intraoperative blood loss within the 500 milliliters. And after major complications, proximal junction fracture and kyphosis were developed in one case, respectively. And some minor complications were also developed, as like this slide. I will show some case. This is 76 years old female. He complained severe back pain and radicular pain. Also, she complained neurogenic claudications. And you can see some multi-level foraminal stenosis and central stenosis in MRI scan. And simple radiograph shows 27 degrees of coronal curve angles. We performed the multi-level ALIF with percutaneous fixation, and you can see some improvement of coronal curve angle. And this MRI is obtained this MRI scan was obtained at 1 year after surgery. You can see the relatively well vertebral foramen and central canal without direct spinal kinetic compressions. This is the case, and 72 years old female. She also complained back and radicular pain. And simple radiograph shows the 28 degree of coronal curve angle and some sagittal imbalance you can see. MRI scan show also multiple primary stenosis and central stenosis, and CT scan shows multiple vacuum phenomena on disc levels. So we performed multiple ALIF with percutaneous fixation from L2 to S1, and post-operative MRI scan shows relatively decompressed intervertebral foramen and central spinal canal. And parallel radiograph shows the relatively well-maintained sagittal and coronal balance. The last case is 60 years old female. Her symptom was improved after surgery, but she revisited our hospital at 11 months after surgery with severe low back pain, and simple radiograph shows development of the proximal junctional fracture, but she didn't want to perform additional surgery. We treated, used some parathyroid hormone and painkillers and pain drug, and so her symptom relatively well improved. There are some articles about minimal invasive surgery in degenerative lumbar scoliosis or adult spinal deformities. In these articles, ALIF, X-rib, or DLIF, sometimes hybrid surgery were reported with relatively good clinical and radiological outcomes. But why are we ALIF? I think the ALIF can reduce some radiation exposure or during the parallel period and reduce some anteplate damage during the procedure, and it can restore lumbar lordosis using the large-shaped cage with lordosis. So, and most of all, in our hospital, the scalpel ALIF surgeon is working, so it's very nice surgeons. So we perform the multiple ALIF with PPF in degenerative lumbar scoliosis. In this study, there are so many limitations can be considered. So like this. So, but as the conclusions, this is very similar to other minimal invasive technique articles. So I wanted to say the multiple ALIF with percutaneous fixation is relatively well effective treatment option in adult lumbar degenerative scoliosis without serious surgery-related complication, especially in elderly patients. Other conclusion is like this. Thank you.